Is intermittent fasting for weight loss a passing fad or a viable therapy? It's a hot topic being discussed and tried by many of your patients. Welcome to Nutrition Edge on ReachMD. I'm dietitian Kathy King. My guest today is Dr. Teresa Pangan, a registered dietitian, health counselor, and keynote speaker with 30 years of clinical and entrepreneurial experience. She is going to discuss with us the possible benefits and precautions of intermittent fasting. Teresa, welcome to our program.
Thank you. It's wonderful to be here.
Could you explain to us what intermittent fasting is and where the idea came from?
Sure. Intermittent fasting, that means voluntarily not eating for specific periods of time. So it can be going for a certain number of hours without food during the day or night or even multi-way fast. So it's an eating program that cycles between a period of fasting and then non-fasting during a defined period. So it's not a diet, it's a pattern of eating. Now, the whole idea for intermittent fasting, it really came out of the research for fasting. We've known for a while that fasting has a lot of health benefits that go along with it, but it's really tough to do. And nor is it always a safe thing to do. So people have come up with different regimens out of this fasting research. And some of them have done their own kind of on themselves, tested and made it into some popular programs, and there's been books published on it. But we've known for years that fasting is a beneficial health protocol metabolically and physiologically, but it's just very difficult to do because compliance is so low. So that's kind of where it stems from. And there's 4 major protocols. I like to say there's different things that can stem away from these 4 protocols, but it's easiest to just kind of get into these 4 different protocols for intermittent fasting. And there's first the complete alternate day fasting method, and that's where fasting is done alternating days and food is consumed then ad lib on the non-fasting days. And then we have as a second protocol is the modified fasting method. And that's the one that you hear a lot about, the 5-2 diet. And that the 5-2, 5 plus 2 is 7. So 5 days out of the week you eat ad lib as normal. And then 2 days, it's usually a low caloric restriction on those 2 days. So that's the second protocol. Then the third protocol is called time-restricted feeding or time-restricted eating. And this is where you can eat within a specified time frame over a 24-hour period, and then you go on a specified fast during that 24-hour period. So it's alternating between a eating time and a fasting time over a 24-hour period that becomes a routine. And then the last method has to do with religious fasting, and that is going to encompass quite a variety of protocols that are just pursued for religious or spiritual purposes. So it's easiest to just think of intermittent fasting under these 4 protocols.
Okay, and what are some of the possible therapeutic benefits of intermittent fasting, and physiologically, how does it work? Does it matter what you eat, or is it just based on the timing?
Well, those are great questions. First, the therapeutic benefits of intermittent fasting. We're just starting to get into all the benefits, and the research is just really taking off in that area. So we really have a lot to discover still in that area. Most of the research that we're finding right now is going to go around hemoglobin A1C and the glucose metabolism. We see a lot of benefit there. And then C-reactive protein for inflammation. So those are the 2 big benefits. There's a lot of other things being looked at, the weight loss, the cardiovascular benefits, and there's a lot of potential promise, but we're still looking for more support in that. As far as how does it work? Well, as humans, we have an internal clock, and it's called the circadian rhythm, and it's cued by, it's regulated by an external cue, light. And the light will cue your circadian rhythm, and it's the clock in your brain, in your hypothalamus behind the retina, and it's actually called the suprachiasmatic nucleus. And that is the master clock, and that is, once it's cued by light, it sets off the circadian rhythm for a 24-hour clock, also called the master regulator, master oscillator. And what this does is it sets off both metabolic and physiological processes that regard sleep, eating, hormones, body temperature, and other processes. Those are the major ones. And so we have this cycle of 24 hours that we've evolved from, with the light working during the day and then at night sleeping. And then we know on top of that there are other clocks in your body called peripheral clocks that are influenced by this master clock. And these peripheral clocks are called peripheral oscillators, and they're in tissues outside of the nervous system. They're in like your liver and the gut, and they're in at the cellular level, and they regulate a whole host of things. And we really are just discovering all that's involved in all these clocks working together. And food is a big thing in the peripheral clocks that is regulated there. And what we know is you have this 24-hour clock in your master clock that's set off with the light. And then we know that eating within that first 12 hours tends to do best, and then the fasting state in the remaining 12 hours. And it synchronizes best then with these peripheral clocks to have the food going on during then. And if we get out of sync, if we start to eat late at night, or if we start to be awake during the night, this is setting off the circadian rhythm, and it's not in synchronicity. And we know that then there's a health detriment. So when some things don't happen, that the circadian clock really wants to put into place for optimal health. And we know if we work with this circadian clock, with the peripheral clocks, then we have a more optimal state of health. And a big thing that happens in this fasting state is some of the repair and the rebuilding. We have some repair cycles that reduce oxidative stress and inflammation. We have clearing away of damaged cells. We refer to it as autophagy, where we've got the lysomes that are picking up damaged cells, damaged mitochondria, cancerous cells, disposing of them. This happens at a much higher level and deeper level in the fasting state, in that non-fed state. And it goes on to a minor degree during the fed state, but we know that autophagy goes deeper and is more extensive in this fasting state. So it will have to be derailed or paused if we start to eat during that fasting state. So this is what we're finding out is these clocks work so much better in synchronicity. So we want to have the fasting happening and the feeding happening there for this repair and this clearing away of damaged cells. I like to think of it kind of like vacuuming. So if you vacuum, if the carpet's in your house, if you vacuum them every day, then, you get the dirt up right away and you keep things clean and your carpet has a lot of good life to it. Whereas if you decide to go every couple of days, once a week, then the dirt is going to get pressed in. And the wear and tear in the carpet is going to be much sooner. It's not going to last as long over the long term. And that's kind of like this autophagy that our bodies optimally want to happen in that fasting state. It is the vacuuming. We get that vacuuming done every day so that we get things cleaned out and we get better wear and tear. Our bodies are in better condition then, and we don't wear out as soon as if we tried to go once a week with the vacuuming and that sort of thing. So that's kind of an illustration that I like to use to kind of get a feel for, this optimal kind of cycle that we find that is in sync with the circadian rhythm.
You're listening to Nutrition Edge on ReachMD. I'm Kathy King, and I'm speaking with dietitian Dr. Teresa Pangan, and we're exploring the popular diet therapy, intermittent fasting. Teresa, what are your general nutrition guidelines for trying intermittent fasting using the most common way? What does someone eat and when?
Well, the most common, the time-restricted feeding, is a protocol where you eat during a state of 8 to 12 hours, and then you have fasting 12 to 16 hours. So I tend to go 11 hours for eating and 13 hours for fasting is a good starting point for most patients. And so that can start in the morning, say at 8 o'clock. Then you would stop eating at 7 o'clock to give yourself, that's 11 hours to eat all your food in, and then fasting throughout the night, no eating, only drinking water. The questions that come up typically are, can I have my coffee? Can I have some tea? And it really boils down to what your goals are for the patient and then what the compliance looks like it's going to be for the patient. Because tea, coffee, things like this, even medications, they are going to start up some of your systems in your liver and your gut, your microbiota there. So that is technically not a fasting state. However, it doesn't significantly affect the systems in your body. The autophagy doesn't seem to be significantly affected by the tea, the coffee. The question would be, are you adding milk or are you adding sugar? I would definitely do away with anything like that. If the patient really wants to have their coffee or tea, I usually let them go ahead. If they can do their medications within that 11-hour window, that's something to consider because those will also start some systems in the body and the clock. They're not significant, but it's something to think about. So those are questions I usually get. The other thing is looking at bedtime. Usually I ask people when they go to bed and when they're finished eating, then with this 11-hour window, and try and make sure that they have a 3-hour window between when they stop eating and when they actually put their head on the pillow. And that is because there's several systems in our body that prep us for the sleep so that when we do put our head down on the pillow, we are tired. So we've got some digestive systems, we've got some hormonal systems, and body temperature systems that will get us ready for that sleep mode. So that's another factor.
Let me ask this. All of my career, I've told patients to eat when they're hungry and not skip meals. We were afraid that dieting or fasting, if they stayed away from food for any period of time, like your suggestion, that one of the ways is to not eat much for a couple of days. Fasting could trigger a starvation response where their bodies immediately stored every little calorie once food was available again. Was I wrong on saying that, or is this just the newest information that's come out?
Well, first of all, that really has good intent because when we give that advice, we're asking our patients to look at their hunger signals, to not be eating from emotions, to not be eating just because they're cued from some habit that they've created there. However, we are finding that there is more to the optimal eating schedule for health, and that things like the light cue and keeping it to a 11-hour window really help. We also know that our glucose metabolism is functioning at its optimal level in the earlier part of the day versus the latter part of the day. So encouraging patients to eat the bulk of their calories in the morning hour or in the earlier part of the fed state is beneficial. As to the question of eating 3 meals and eating every couple hours, we really don't know for sure. We have some research on that, but we don't know exactly what is the best answer for eating meal frequency there. So we're looking for the answers there. We don't know exactly because the glucose, looking at that and looking at the part of the day. So I would look more at keeping with the 11-hour window and look at the patient's lifestyle and look at increasing the quality of the food that they're eating at the different times throughout the day and looking at where the challenges are. So there's multiple factors now to consider.
I appreciate that. Teresa, in conclusion, can you summarize 3 to 4 points you want us to remember about intermittent fasting?
Sure. Well, eating in this 8 to 12-hour window and the 12 to 16-hour fast with 13 hours for fasting, 11 hours to eating is a really good place to start for compliance. We also know that there is benefit for holding this time-restricted eating 5 days a week so that you can have relief knowing that if on the weekends, because of your lifestyle, that you have to go outside this window, we still see benefit from the time-restricted feeding 5 days a week. So that makes it a much more livable regimen for people. And then stop eating at least 3 hours before putting the head on the pillow, looking at that, making sure it's not getting to the fed state is not ending too close to the actual sleep cycle is another tip. And then the last tip would be when people do switch over to this and they've been used to eating at night, give them heads up. There's going to be a little adjustment with their body. It might take a couple days because they might be hungry during that time that they were usually eating. And it might take up to a couple weeks, up to 2 weeks. So if they know to expect that in advance, it really helps it. They will adjust, their body will adjust, but it might take a little time.
Teresa, thank you for bringing us your nutrition insight.
Thank you.
Our guest has been registered dietitian Dr. Teresa Pangan. We've been discussing intermittent fasting. I'm Kathy King, and you've been listening to Nutrition Edge on ReachMD. Be sure to visit our website at reachmd.com, featuring podcasts of this and other series. Thank you for listening.